diodes look like. Okay, and this is a description of the sound head. It has 4 red diodes, those are the bigger ones, and then it has 32 infrared diodes. The red diodes are 660 nanometers in wavelength, and the infrared diodes are 880 nanometers in wavelength. It will actually, you can use this is the cluster probe, but you can also use something called an infrared light pad to deliver infrared light as well. It's a flexible pad, has a lot more diodes on it, and basically you kind of lay it over the area that you're treating. Okay. We don't have that, so we just have the cluster probe. There is also an associated protocol book. So just gonna, and it gives you some guidelines in the front where you treat someone 2 to 3 times per week, and how many joules you need to deliver. And most of it is pretty low, somewhere between 2 and 8 joules per centimeter squared is what this recommends for these particular conditions. I am actually gonna just pick something on myself. It's so simple, you'll all be able to try it. So arthritis of the first MP joint, okay? And basically it's saying dosage 2 to 6 joules per centimeter squared. So on here, first you have to pick light therapy. And this machine actually can have a laser. We don't have that, we just have the light therapy. So it says cluster, and that's what that means. It's this cluster probe. And if you look up on top, where it says channel, it will actually have 3 probe lit up, and it will have time, and then in terms of the rate and duty cycles, next to that it'll have joules per centimeter squared. So it's already set up. You don't have to do anything else. You just have to put in your dosage. So I'm going to put in 4, and every time I change the joules per centimeter squared, my time changes. So if I'm going to deliver 1 joule per centimeter squared, my time is 5 seconds. If I'm going to deliver 2, it's 10 seconds. If I'm going to deliver 3, it's 15 seconds. If I'm going to deliver 4, it's 20 seconds. So once you put in your dosage, the time is preset. You don't have to determine that. All right, so we're going to do 5 joules per centimeter squared, so it's going to be on for 25 seconds. So you need to clean the area. Okay. You need to clean the cluster probe. Put it on the area parallel to the tissues. On the probe, you'll see there's a button switch. It will light up yellow when it's ready. Okay. Touch it to the skin. I press it. It feels kind of tingly. Charge for that?
No.
25 seconds. Are you kidding me? Which is why it's a very expensive thing, and it's very difficult to use. So I know that at the clinic, we actually had the clinic manager come in and give an in-service on it. He was like rubbing it and doing all kinds of myofascial stuff with this. I don't know what to say about that, but in the meantime, that's the use of it. Okay, you can really treat anything. Try not to do it over, endocrine type tissue, eye, gonads, uterus, okay, ovaries, anything else in that arena. Okay, and don't look at it. You know, I don't care what it says, it really isn't meant to be looking in your eye. So don't be like, oh, let's turn this on and let's look at it. I will not be held responsible. You know, if this was a laser, okay, then I would have to have the goggles, my patient would have the goggles, but the treatment really would end up being the same. I would put in my dosage, it would preset the time, and then I would turn it on. Simple, okay? So I expect everyone to try it, okay, because I need to check you off on it. You can actually make it pulsed, which I've never done before. Evidently, maybe not. Well, according to this you can, but evidently I can't, so we'll just then leave it continuously. Any questions on light therapy? How to document it, how to deliver it. This is the simplest thing besides the hot pack and cold pack that you could learn in here, okay? And as far as the understanding, remember big picture. I'm not as much caring about the little tiny details as I am your understanding the effects that it has and the basic notions of how to apply and what affects depth, et cetera, et cetera. Okay? All right. Anybody want to try?